Hello, everyone that is watching online. I'm going to give it a few more seconds because we did just send out the link, just in case people could not find it. In a second, I'll be sharing my screen and we'll get started. I am going to go to the next slide. Oops, sorry. I'm going to go to a couple slides back. For those of you online, if you want to take your phone and bring it up to the screen that you're seeing, you can go onto the QR code, or on our website, there is a link to a questions document. Our hope is that we answer most of your questions during the presentation. Tim Dawkins, the Assistant Superintendent for Curriculum Instruction, is also here and will be monitoring the link and will be able to help me answer questions along the way. Matt Greet is also with me today, Director of Athletics. If there are specific questions related to that, he will be able to answer those. It's already been a busy season for us, and we are happy to see our students out on the field. So I'll leave this up for just another minute and then we will get started. Good morning, everyone. Thanks for joining us on this last day in August. I hope all the families and especially our students were able to enjoy the summer. I know some days were nice and then we had lots of rain, but it was still good to be outside and to reconnect with people for these last 2 months. As I mentioned, if you just got on, it is great to see our students out on the sports fields each morning. When I pull in, I get to see lots of activity going on, and that sure feels like a great thing to start the 2021-22 school year. This presentation is slightly later than last year, and while I'm sorry for that, and I'm sorry that our state has kind of put us in limbo a little bit because of some other things going on in the world, I am glad that we waited so that way we can give you the best information possible for the presentation today. Actually, I have to stop my screen for 1 second. I apologize. I have a different presentation I want to show. Mr. Dawkins, do you want to tell everyone about what we did this summer? Well, I'm switching my screen for a second with all the different activities that took place.
Yeah, absolutely. It was actually a really busy summer and a happy surprise at the end of last year when federal funding came through the ESSER funding for us to be able to support things that we wouldn't necessarily have been able to in the past. It was a really, really popular summer for our music enrichment programs, and that was really great to see kids in the buildings with our music teachers and some of our other faculty doing some theater performances, and those went on mostly in the middle school. And I went and visited those a few times, and the kids were really excited to be there, and it was great to see them having a good time. Our athletic offerings over the summer, which certainly Mr. Grebe can talk about more, were extremely popular. I think we had a couple of hundred people sign up for them on the day that we released the schedule for when those training sessions were going to be available. So we had a lot of athletics going on. One of my favorite things that we did this summer was our library book bus, which went to different parts of the community on Tuesdays and Thursdays. I was able to ride around in that and meet some of our families that came out. And there definitely were regulars that came to see the bus every week, and they had their favorite books. And I'm really thankful for our library media specialists, our administrators, and other teaching and support staff that were able to volunteer their time to ride that bus around and to make sure our students had reading and books available to them over the summer. So that was just really a snapshot of some of the things that we did. It was really busy around here. I know that we talk about summer break, but really schools are open all year round, and our schools were definitely open this summer.
Great, thank you, Tim. Okay, so back to our reason we're here, reopening 21-22. You know, last year, we had a goal that by the end of the year, we wanted 100% of our students back. And unfortunately, because of all of the rules and some of them that had not changed, we were only able to bring back pre-K to 6th grade 100% of the time. So our goal this year remains the same, 100% of the students back 100% of the time in the safest way possible. And that will be our goal. And that is what we are going to do on the first day of school. Here are a couple chief priorities that we have to make this happen. We want to make sure that we can have 100% capacity in all areas. We need to make sure that whatever we put in place, it safely maintains in-person learning for all students. And we know that while students are excited to be back in the building full time, they also miss their extracurricular activities. They miss those fun things that they get to do after school, athletics, clubs, activities, the plays. So we want to try to do everything we can so that way we're not only open for the academic side, but we're open for that other side. We know that that social emotional learning and the general health support is necessary every day for our students to be successful here. And that will continue to be something that we think about as we are looking to our reopening plan. As I said before, this is the link or the QR code to a question and answer page. Mr. Dawkins will be monitoring it. However, we are going to do a significant amount of the presentation. We may pause along the way for certain things, but he will jump in when he finds it necessary to make sure we can answer questions that you have. You may have heard, because other schools have started to come out with different information regarding reopening schools, but across the region, we have been working together not only with our 31 schools in our BOCES, but schools across the capital region to talk about what we can do to safely reopen. And what we are talking about today is what we call a tiered mitigation approach. There are key elements to this tiered mitigation approach. We want to look at the level of transmission in our county. These levels are set by CDC and they have very specific criteria to them. We talk about it in terms of low, moderate, substantial, and high. Unfortunately, Saratoga County and most of our surrounding counties have been in the high zone for the last few weeks. We have to look at our vaccination rates for the staff and the community in order to see if we need to change anything in our plan. Also, we know that a large part of our population, our 5-year-olds to our 11-year-olds, are not able to be vaccinated. And we need to figure out how that plays into our plan as we continue to move forward this year. We have to look at how we quarantine students. We have to look at universal masking. We have to look at any federal or state mandates that come up along the way. Finally, we also are going to look at what we call school environment measures. We have to look very specifically at the daily average positive cases in our own school community. We have to think about screening testing. Last year, parents, we used the BinaxNOW Now, and you were able to volunteer for screening testing. We're going to talk about that a little bit this morning. It changed a little bit, but we're hoping we make things a lot easier for our families along the way. Obviously, just like last year, we have to look at how many students and staff we have to quarantine because they have been around a positive person or they're positive themselves. So we do this all on a regular basis, but we want to make sure that now, because we know more, we're sharing it with all of you. These should come as no surprise to anyone on the line right now. Not only do we have a tiered mitigation, but we have layers of mitigation. And I know that some of these come out in the media much more than others, but for us, all of these matter in various ways. And because we're doing something in all areas, that is what we believe has kept our schools so safe in the last year and will continue to be in this year. You'll see that the very first thing the CDC recommends when you talk about layered mitigation is promoting vaccination. And I know that vaccination is one of those topics that's a tough one. There are definitely people on this call that probably are already vaccinated and are hoping every person in our school community is vaccinated. There are other people that don't feel comfortable doing that. It is a personal choice, and I know that, but I would be remiss to not talk about the CDC recommendations here in talking about vaccination. So you will hear a little bit about that today. Obviously, mask use continues to be a part of this: physical distancing, ventilation, hand washing, screening, testing, staying home when sick, and then the normal contact tracing, cleaning, and disinfecting. And we'll talk about all of these briefly today. When you talk about a tiered mitigation approach, what does that really mean? A couple things that come up is how often will we change the plan? The idea is we aren't changing the plan every single day. Quite honestly, my team here looks at things on a daily basis. But just because something may change, we want to make sure it's consistent over time. We are in the high right now. We don't want to jump to any conclusions that that's going to get any better anytime soon. So we will always look at them in 2-week cycles. You will always hear from me at the very least every 2 weeks. But now that school is starting again, a weekly email through School Messenger will go out to families. And I know that our principals will always keep you up to date on things. Again, we will not change daily because we want to make sure that it's the safest time and we're not just changing simply because the situation changed for 24 hours. Who has been consulted on these decisions? I've received several emails, again, from lots of people, and I'm always glad to hear from them. It always helps me understand where the concerns are in our community and helps me have this program there. I will tell you that a few people have written to me to say, I need you to look at the science. I need you to really understand what is going on in this. And I have to be honest, I went to school, I was a math major, and then I went in for education. I have no background in the science field, and that's okay, because the school hires people to look at the science, and I, as superintendent, need to put a team together that can look at these things and give us recommendations. Good leaders need to make sure they're not doing these things alone. We absolutely in South Glens Falls did not do these things alone. I have weekly calls in with the Department of Health. Sometimes I call them more often. Bristy Tracy, our head nurse in the district, and I have talked to our school physician often, and his guidance has helped create this plan. We've looked at New York State Education Department and New York State Department of Health and their guidance and recommendations. We know that they're always giving us more. Even this week, we expect more to come out. We've talked with our local schools. We understand that schools around us play an important role on this, and we have families that may live in our community but work in other communities, and we want to make sure we're as close to this as possible to each other. And obviously, our Board of Education plays a role in this. They are part of the conversation as far as we will always present to them where we are with this. I know there's some people out there that have asked why they are not voting on this, and after consulting with our school attorneys, to be honest, we reopen schools every year. So reopening is not necessarily a voted on experience. Basically, they've continued to give me the go ahead to keep working with this team of individuals, including our administrators in the district, to create the best plan for our students. When you think about transmission and you think about where we are with this, there are 2 places that we can go for that. So I'm just going to click on these quickly so you can see that there is lots of data that we are looking at as we're having these conversations. The first one is our Saratoga County Health. Tim, can you just give me a thumbs up that you can see the health thing on there? Thank you so much. This gives us lots of information. It gives us the positive tests in the last 7 days. So it's accurate, it's not a cumulative piece. It gives us our rolling average, our transmission rate, and so on. One of the things I like about this is it very quickly tells us where we are in terms of things, and it makes it very easy for everyone to see, and you all can get there as well. The other place that we can go is CDC. CDC allows me to put in our state, our county, and come up with our transmission. And you'll see that we are still in the high. Actually, yesterday Washington County was in the moderate, and now they're in the high again. So that piece has changed. But one of the things I want to show you is down here. And I think this is really interesting. I like to look at trends, and I think it's important for us to see where we were last year and where we are this year. So I'm just going to slide this scale, and anyone can do this at home. And you can see that last year, when we talk about positivity change, we were almost close to 0%. But we didn't know what would happen. We didn't know how transmission would take place in schools. And we learned a lot this year. Obviously, we went up. And now we are at, as I said, 4.7 or just over 5%. So we are in a different place, but we also know more. We also know more about what's happening with our students. We also know more on how to use the mitigation strategies to make things happen. But I encourage any of you that are interested in this information to go to either of these places and take a look. These are what the CDC transmission thresholds are. I'm not going to spend a lot of time on that, but that is what we're using. This isn't a South Glens Falls only system. It is something that we're, basing on based on the information that's given to us at the national level and at the state level. These vaccination rates are probably a little old. I only get updated on these every once in a while. Right now, they talk about vaccination rates by zip code. And so that's why the 12831 has an asterisk, because it's not just our district, it could be other districts in there. I want you to know that, again, we understand that 4 elementary schools in our district have most of the people in there completely unvaccinated. And that's why we're having the rules that way on that. So I'm going to get started. I know that the first topic that people will have in their minds is masks in schools. And quite honestly, this slide has changed since I sent it home to you all a few weeks ago. You note in that slide, when I sent it home to you a few weeks ago, there was a tiered mitigation approach. I continue to think by the end of the year that will be the approach that we will be able to take. However, one piece of information that did change by the Department of Health in New York State is that all students and staff will wear masks indoors and outdoors. Right now, there are no masks, but I know that will be reviewed in the fall based on transmission levels. That is guidance. That is not just guidance. It is written that the Department of Health requires that. And obviously, transportation requires masks at all times. Again, I know that there are feelings on this on both sides, and we will continue to monitor the situation just like we did this summer. In summer school, we gave parents the option of no masks because we were in the blue, and that is something we hope to do along the way this year once we know what our level is. Screening testing. This one gets a little bit longer because this is a mitigating strategy that I truly believe from what we did last year keeps our doors open. Our team of people that helped doing the proactive screening worked very hard at it. And I realized there were some questions along the way about whether we're using the right tests for that. Our Saratoga County Department of Health is working in partnership with every school in our county to offer screening testing for our students. We are in the high zone right now. So that's what I'm going to focus on, is where we are. And so we are going to be offering screening testing that to our students that are unvaccinated once per week. It will not start on the first week of school. It will start on the second week of school. And that's why I want to make sure we get information home. It is by parent consent only. We will not be doing this unless parents choose to have this happen. We had a large percentage of our students sign up for this last year. And we were able to, when the transmission rates became high, we were able to test many of our students using the BINEX tests. We were able to catch positives that maybe we didn't see, so that way we can mitigate the situation. This year, the test has actually gotten less invasive, and I'm going to share a video that I helped create with the Department of Health on what this looks like. It's only 2 minutes. I encourage you to watch the whole thing. It will be sent to you in our weekly report. It'll probably be sent again when we come closer to that. Tim just a thumbs up if you can hear it too.
No, we can't hear it, Christine.
Okay. Well, you gave me the thumbs up, Mr. Dawkins, so.
I'm sorry. I thought you said if I can hear, if I can hear you, which I could.
Okay. So I will take two. I will come back to this at the end when I can play it directly from another spot. So I will keep going because I know people in the morning have a lot of things going on. But what essentially I can show it to you. What it is instead of it being in the nasal test, it is now a swab where you swab inside your mouth, and students are able to do that very easily. And once they swab the mouth and they're able to do it very easily, they are then able to get it sent out 24 hours. Because screening testing is proactive and students are asymptomatic, life just simply goes on, and parents are able to sign up for this and get their results on a regular basis. As I say, it is described in the video, and I will make sure to share the video with anyone that is there, but also we will be giving information on how you sign up for that. The opposite of screening testing, which will take some planning and some time, and really that's where our focus is going to be. But our opposite of this was there was a deep frustration with families when our children were sick last year, and we had to make sure that before they returned to school that they were COVID negative. It was frustrating it was very frustrating at the beginning of the year because we didn't know all the rules, myself included. We didn't know all the rules. And so again, I'm going to focus on the red. One of the things that I'm hopeful our families will be supportive of this year, and again, it's always by parent consent, is if we have children in a district that start showing symptoms in the school day, and it could be several symptoms related to COVID, it could be a few symptoms, we can offer our families a proactive approach, and we can test our students with a PCR test or with a BinaxNOW test, and then send out for a PCR test depending on the time of year for the school. We're able to do this so that way the turnaround time for your child will be less than the 72 hours that was last year. Your child's still showing symptoms, so they need to go home. They need to feel better, whatever is happening to them. And then when the symptoms subside, when the results come back, which is usually within about a 24-hour period, you would know and we would know. And if they're negative, they can return to school. Obviously, if it's positive, we would work with you to make sure all these things are happening. The difference between last year and this year is we had to give you information. You had to go to your doctor, you had to schedule an appointment. Your children had to stay home to wait for that. We are trying very hard to help families erase some of those steps. Obviously, your first concern is always contacting your physician and making these decisions. But if we can help along the way, we are partnering with Saratoga Department of Health to do that. It would be the same swab test as we get going in mid-September for that to happen. You can even be there while you're picking your child up for it to take place. There will be more to come. I'm meeting with all of our school nurses today on this, and you will be getting home not only a video for the screening testing and for the paperwork for screening testing, but you will also be getting information on what to do if your child is symptomatic. Mr. Dawkins.
So, I just thought this might be a good time for us to insert a couple of questions. We do have a question that pertains to this, and it is, if one sibling is sick, does the other have to stay home?
So that's a great question. And I knew that would be there. As of right now, because we're testing, if the testing were to take place and if the parent were to agree to the testing and we would know more, the children were asymptomatic, the siblings would not necessarily have to stay home because we're doing the testing. If no testing is being done, then we'll be under the impression that the siblings have to stay home until that takes place. So I think that will be a positive in the household. As long as everyone else is asymptomatic, they'll be able to come to school as long as we're working on the testing of the symptomatic person.
And then we have another question that says, since many studies have shown that COVID can be carried and transmitted by vaccinated individuals as well as unvaccinated, with vaccinated more likely to be asymptomatic, isn't having testing for vaccinated students just as important as having it for unvaccinated, especially when we are in the high zone?
Yes, so I completely agree with that statement. I'm vaccinated. I want to test as often as I can. Right now, we're focusing on the unvaccinated simply because we want to get it up and running, and we want to make sure that we have a system. We've been working with our Department of Health because, again, this is all steeped in CDC requirements. We've been working with our Department of Health to say that if there are vaccinated people and the choice is there where vaccinated people want to get tested, that we have the ability to do that. So I do agree, and we are monitoring that really it should be all people, and we will continue to give you information when that changes.
I think there's a couple other questions for things that we haven't gotten quite to yet, so we'll hold off and we can keep moving forward.
Okay. Quarantine and isolation, all of the counties have gotten together, Saratoga County and all the surrounding counties, all the way up and down the Cap region, have gotten together, and they are coming out with their own set of information for all schools on quarantining for that. I know that everyone talks about 6 feet, and now it's changed to 3 feet, which it has. There's some exceptions with student-to-student contact. I know that I've heard from people about what does it mean to have well-fitting masks. That is one of those interesting words of who defines well-fitting. And I truly believe we're doing the best we can as far as paying attention to what type of mask we're using for that and making sure that they're on there. Fully vaccinated students and staff do not need to quarantine. So as parents, if you have had your child vaccinated and they are fully vaccinated and you have not contacted your school nurse yet, please make sure that you do, so that way we know that if, for heaven forbid, a positive case comes and your child was around that, if your child's asymptomatic, they do not need to quarantine for those things. Athletics and extracurricular. Mr. Griep, I'm just going to turn this over to you to get a quick summary of where we are right now. We are in the high risk, but we do have all of our fall sports going right now. And not only do we want our fall sports to be going, we also want our extracurriculars to be going. So if you want to just give a quick summary on that, I'm going to stop sharing so they can see you.
Yep. So what we're doing is basically everyone in the foothills is going through a tiered or a phased approach when it comes to reopening. It's understood that we are in a high transmission area right now, and Christine and I got together and we wanted to promote or push forward a phased approach in tier 4. CDC recommends that once you are in a high transmission area that you shut down high risk sports or high contact sports immediately and you go remote with it. We felt that our success rate last year with athletics was one of the best in the Capital Region due to our testing policies and the security blankets that we had in place with our students and our coaches and our staff. So we're very confident that we're going to be able to make it through our season, even though we are in this high transmission area. But we wanted to kind of put a scaffold approach into this. And so if we saw our rates continue to grow, we would start to put more restrictions in place. Right now, the only restriction that we have in place in terms of our high-risk transmission area is we are currently in phase 1, where we're testing all high-risk athletes that are unvaccinated, and then all our indoor athletes must be in masks. And that we're going to reevaluate that situation every 2 to 3 weeks, and we hope that we can eventually regress and go back into the blue and the yellows, and that way we can promote athletics and extracurricular activities without a mask, and we can invite people in and keep our doors open for as long as possible to give them that traditional experience that they missed so much last year.
Thank you, Mr. Griep. I'm going to reshare my screen now. So again, right now this says just unvaccinated with screen testing. However, Mr. Griep and I continue to have conversations along this about vaccinated and unvaccinated. I encourage you, if you're a parent of an athlete and you want them tested every week, no matter what, we are happy to do that. So just, contact your coach and we will make sure that is happening right now. Band, orchestra, and chorus are also listed under high-risk activities. So I would expect that if your child participates in these, a letter separately will go home regarding these activities, because we want them to take place. We want them to sing. We want them to play their instruments. We want concerts to take place. And so we're going to do everything we can to make sure that that happens correctly. Some of these, again, are very similar to last year. Obviously, the physical distancing has changed. We did have everyone at 6 feet apart last year. And then in the elementaries, they were able to go to 3 feet apart towards the end of the year. Now it says, to the extent possible, students and staff will be 3 feet apart. And that key piece is to the extent possible. State Ed and CDC both state that school being in person is more important than worrying about the physical distancing. We're doing everything we can to keep our students 3 feet apart, but we know that the in-school experience is what we have to focus on. I do know, I think, Mr. Dawkins, there were some questions about the cafeteria in regards to this, and I'll get to that in just a minute.
Yes, there were. Yep.
Okay, thank you.
Actually, there was a questions about the cafeteria. There was also questions about eating outside, which I can talk about when you get there.
Perfect. So obviously, you know, there are things we think about in that 3 feet, but we also know that group work is important. We also know that play is important. We also know that students want to be out on the playground and not have to stress about, is it their turn for the equipment? And all those things are in place, and we're doing that. And obviously, masks outside is not necessary. So those things will happen there. For 2020-21, we're doing the same hand washing and respiratory etiquette. So we do have hand sanitizing stations in the building. We have hand sanitizing stations in the rooms. We'll be constantly monitoring them. Cleaning and disinfecting, we are doing the same protocols as last year. They worked. We have disinfecting electrostatic sprayers in the buildings. Our people have gotten very good to be able to do those in each room at least once a week, if not more, for that. And then obviously ventilation comes up. You know, each year I get 1 or 2 emails along the lines of, what are we doing and with ventilation? What are the air filters? Why aren't we air conditioning, et cetera, for that. The recommendation is to keep our windows open and our doors open, and thinking about that for that fresh air as much as possible. We have opened up our ventilation system, so there's more fresh air coming in last year and even more this year, again, as a recommendation by the Department of Health to do that. On transportation, windows will be open as much as possible for that component, and we'll be making sure that the windows are open as much as possible. School modifications. Obviously, we just talked about classrooms being to a more typical layout. Students may be in tables, they may be in desks. They'll be able to work together. We'll be able to use the gym back to its utilization. Cafeterias will be back to full utilization. What we're recommending, because at the elementary school, we already stagger our elementary cafeteria. We'll be using the full cafeteria. Students will be seated every other seat. They will have assigned seats. They will be able to talk in the cafeteria. I know that was a question at one of the recent board meetings for that, and they'll be able to do those. At the middle school, it's one classroom or one grade level, excuse me, at a time. And again, that space is big enough where we can use the entire space, space our students out. So that way the 3 foot distancing is still possible there for that. Windows will remain open for fresh air as much as possible in that area. Mr. Dawkins, I'll let you talk about the outside eating before I talk about extreme heat.
So once again, at the high school, we have a number of picnic tables that are outside that were used last year. It was a big success. Actually, we're very thankful for our technology department for building all of those tables for us. They were all made in-house. And so students will have the opportunity to eat outside as much as possible with the weather as we move from summer into fall and then into winter. We are having conversations right now about how we can also do this at the middle school. I actually just had a conversation with our interim middle school principal, Geraldine Stellato, excuse me, about whether or not we can make this work. Right now it's just about finding a source for the picnic tables. So we're going to be having some conversations, and I predict that we're going to be able to offer that at the middle school as well.
Thanks. Extreme heat. We live in the Northeast where we do get bouts of extreme heat, but luckily we tend to have varying differences in our weather. When the summer came and we had students on our campus and extreme heat took place, an email was sent to all of our teachers and our staff members about mask breaks. Technically, mask breaks are not part of the CDC recommendations anymore. They were not part of our Department of Health recommendations. However, because we know that heat is a problem and could upset not only our students, but our staff members, we wanted to make sure that we put in writing to our staff that these could happen. They did happen. Each teacher paid attention to that. And then shortly after, masks became optional. When we open up this year, I had a voluntary staff meeting and I specifically talked about this with them on that. And I was able to talk to them about what opportunities that they could have so that way their students were not in masks all day long. We want to see our students outside as much as possible. I can tell you that at the high school level, our students, our teachers here have definitely done full classrooms outside for 80 minutes. So that way our students were not masked during that entire time. I think, Mr. Dawkins, there was a question about it being like a snow day for this. Is that correct?
Yes, that is
So,
correct. Yes, we're talking about using it as a day off.
Yeah, so snow days are very specific in terms of what we can and cannot count. The reason why snow days exist is because we cannot physically get students to the building, where with heat days, that's not necessarily the case. We will be looking at what their recommendations come out to be and what we can do to get to our 180 days, so that way we can have that happen. But just as I always say to parents, you know, there are times where in extreme cold, they're worried about their children being at a bus stop. Obviously, on those cold days or on those hot days, parents always have the right to keep their children home and take care of them from there. And we can always work with our teachers to get makeup work to them in that capacity.
And so since we're talking about, remote learning, I'll let you do this. And there's a couple questions about remote learning.
Yeah, great. So remote learning. So this year, our model is simple. We are back in school. However, we know that we are going to have students. We have students right now in quarantine. We have students right now in isolation, and we want to give them an education, and that's our goal. And we know that we need to stay in contact with them for that. So last year, some of your teachers may have sent home pivot plans. They may have shared with you that information. Obviously, our littlest kindergartners will have a hard time with that in the beginning until they learn all the systems, and we realize that. But our teachers directly will be working with our families on when students are in quarantine or in isolation to provide a continuity of learning. That means that they will be on Google Meets. They will be checking in. They will be doing their classroom work. They will be able to see everything through Google Classroom and so on. They may be on with small groups. They may be on with the whole class, but it will be based on that teacher and that grade level for the plans for that. So that is the expectation, is that students would still be able to work. Now, obviously, if somebody is isolated and they're not feeling well, they're just sick, and they're going to be sick as like they were any other year for any other thing. And then we would work with those families on how to make up the work there for that. So this is a high level part of this. I know that depending on your grade level and your teacher, more information will come home. I know that there are some students that will be quarantined for the first day of school, and it makes me very sad because that did not happen last year. So we will be giving those families, if you're on a call, to talk about that prior to day one.
Since we're talking about learning and in the classroom, there are a couple of questions about masking, mask breaks. So just some folks wondering about mask breaks in the classroom. Will they exist? And how are we going to handle that this year?
Yeah, so they always exist. We do give them. We encourage every child to bring their own bottle of water to school, and we have about water fillers around all of the schools to refill them. So at any time, students are allowed that opportunity to be able to drink the water and take the break, and that way. At the elementary level, quite honestly, the students get nervous about just taking their mask off. So our teachers do a good job of providing those opportunities, both inside and outside, to have those breaks available.
Okay. So,
that was it.
yeah, there's a few other ones, but I'll let you keep.
Good. So when we talk about this, we talk about adjusting the plan, obviously regularly. I will do these as many times as we feel we need to do. I will send out as much information as we need. Obviously, the communication will come through school messenger for all of this. And each building principal will talk about it in their weekly updates and things like that. Change could happen when transmission levels change. As I said, right now we've been in the high for a few weeks, so I fully expect all of September for us to be in the same space as we are right now. And then vaccinations will be tracked, and that may be a factor in any change that we have. Vaccinations. It is the leading public health prevention strategy to end the pandemic. I know that there are many out there that do not want to talk about vaccinations, and I completely understand your choice. However, in order to support our families and maybe some of their concerns, we are going to be offering a vaccination clinic to everyone this Thursday in 2 days, right at the high school, right in the high school cafeteria. We will be offering this. It can be our students, ages 12 and up. It can be the parents of the students if you want to do that together. It can be any of your family members that may have been too afraid to go anywhere else and they feel comfortable in school to do that. We are basically taking anyone. We have this link here on the screen. We also have it on our website for you to do that. We also take walk-ins. We will take walk-ins that day. Again, this is your choice, but the school wants to provide as many opportunities to keep our students as safe as possible. And if this is something that you support and you want to join us on this day, we're happy to have you. Finally, I think that the biggest thing we talk about, and I was always so appreciative that our Department of Health always talked about this as well, is there's the physical health and the health in the building and the safety in the building of the physical safety. But we also have the mental health and the social emotional learning. Janelle Sibowitz joined us this year as the Director of Counseling SEL. Anthony Kenny is working specifically on Open Circles K-5. And we are even adding a Gaggle platform. Mr. Dawkins, do you want to talk about that a little bit for our students so that way they know what information is coming on that?
Absolutely. So Gaggle is a service that we have contracted with for a number of years now as we moved and implemented the Google suite of tools, Google Docs, email, Google Sheets, things like that in order, and especially as we went one-to-one with all of our Chromebooks. So as our K through 12 students got Chromebooks and were able to take those Chromebooks home, knowing that they were going to be using our services and our filters in order to navigate the internet, and as a way to support families as well that aren't always able to have eyes on, we have the monitoring of our filters. So if there are dangerous or unacceptable things that kids are engaged in, we are notified as administration, and we are able to deal with that and work with families in order to tackle those subjects. This includes any kind of concern around mental health, such as students expressing depression, anxiety, self-harm ideation, things like that. We would be notified, and we have been notified and worked with families. Gaggle has expanded their services, knowing that more and more students and adults are seeking mental health support during the pandemic with everything that's going on. And so they reached out to us to let us know that they actually offer a virtual platform, which really is in line with how pretty much every mental health practitioner is doing their mental health work right now. It's few and far between where you actually find a practitioner who is seeing patients in person. So these are virtual conversations or on the phone. Knowing that we have seen an increase in our own students, we wanted to offer another resource. And so we are opening this up to all of our students and all of our staff. It is not based in insurance. The cost is completely covered by the school district, and it is virtual therapy sessions that students are referred to in conjunction with families. We as a school district would never refer a student to outside mental health counseling without cooperation from families. So that is something that you would be involved in. There will be a flyer and information going out to our entire community about how to get students signed up for this. This certainly does not overshadow the work that our in-person folks are doing, our school counselors, our social workers, and our school psychologists throughout the district, as well as our 2 in-district therapists from Saratoga Center for the Family. But we know that there are still a lot more folks out there that don't need necessarily the intensive day-to-day work, but may need a few sessions. The average length of sessions with Gaggle virtual therapy is between 8 and 10. Each session is 45 minutes long, once a week, and they are available outside of school hours. So not only are they available during the regular school day, they're also available during the evening and on weekends. So for families that need that aren't able to necessarily get themselves to an appointment or haven't been able to access a therapist or a mental health professional because their caseloads are full, this is another great resource that we're really excited about.
Thanks, Mr. Dawkins. So I put up the QR code one more time in case there were any other questions that came in for that. So I don't know if any other questions came in.
There are. Yep, there are definitely questions. I can't remember if we touched on this, we may have, but there was a question about how will distancing work in the cafeteria when kids will be eating and drinking with their masks off.
Yep, so it's 3 feet is the rule. And so each school is doing it a little differently, but essentially there will be at least every other seat available to maintain that 3 feet piece to this. I know at the high school level, they're even looking at obviously the outdoor space, but the auditorium similar to last year. And the middle school is 6th through 8th grade is 1 grade level at a time. So we're going to be able to really separate the students in the room to be able to meet those requirements.
There's a question here about students being assigned lockers. And I know that there was a process in place, I believe, at the middle school. I'm not sure about the high school.
So 7th and 8th grade, the locker piece came out. It was not on the schedules, I can tell you that. If you go back into school tool for 7th and 8th grade, you should be able to see all of the lockers. Mrs. Barber is the one that is working on lockers. 6th grade, there's enough change that needs to take place in their world from 5th to 6th grade. So lockers will not be a part of the conversation for a couple of weeks there on that. High school, we have very few students that actually want lockers. So if you're a 9th grade parent looking for a locker, just contact guidance or the main office and they'll make sure to assign your child one. So that way they have that for orientation. But we no longer assign the lockers at the high school because no one used them for that.
We have a question that says, Dr. Fauci just last week acknowledged that the country can get to herd immunity by spring 2022 when counting those who've had the virus and more importantly have antibodies. Have there been discussions at the state or Department of Ed levels to acknowledge and treat students who can show antibodies through formal antibody testing the same as vaccinated individuals?
The short answer to that question, Mr. Dawkins, is no. Right now, because we have not gotten to the level of vaccination that the state is looking at, they have not talked about that. However, I can tell you, usually in a school setting, we're always a couple months behind what the recommendation is for that. So I can almost guarantee that that will be part of the conversation in the future.
Okay. There is a longer question here, again, about transmission rates and going remote. It says, last year wasn't the threshold for full remote learning a transmission rate of 4% or higher. With our rolling transmission rate at 4.7% and all of elementary school students still unvaccinated, why would we not start the year completely remote until transmission levels come back down? Also, I believe one of the reasons why the positive cases were so low was because of the stringent 6 feet social distancing, mask wearing, and ensuring kids who displayed symptoms, as well as siblings, were sent home immediately until negative tests were received. Are these policies remaining the same this year, considering the high transmission rate? Will students pivot to full remote when reaching a certain positive threshold? Will 6 feet social distancing still be in place, which I believe we've answered? And if not, what is the justification for not implementing the 6 feet rule with the transmission rate so high? Lots of questions in there.
Yes. So, I think first and foremost, we know more now this year than we ever have. And we've gotten really good at all of the mitigating strategies, not simply just one or two of them. So, that's why I showed at the beginning of the session where we were last year, where we were this year. That 4% was there and we were worried about it, but we know more now. And so we know that we have confidence, not only in our district, but in districts across New York State to be able to open and add mitigation strategies to keep our doors open for that. So with that said, that is why we don't have a certain percentage right now. As far as what that would look like to pivot to full remote, we will be using all of the data pieces and the numbers, not just simply the transmission rate for that. The 3 feet comes into play because that took place last year. That was a recommendation. It went from 6 feet to 3 feet for all schools. And that is what we're using this year. Again, if we find that we have to quarantine more students, I know that many of you are watching the news every night, as I do, and we tend to pick and choose which ones we want to listen to, which ones we don't want to listen to. But in the same sense, we know that there are definitely quarantines going on in districts that have different and varying mitigation strategies. If we find that our mitigation strategies are causing either more quarantine or more isolation, we will change them. We will adjust our policy. We will make it more stringent. We will go to what we need to do to keep our students safe. But with the guidance that we had over the last year, we truly believe that we're going to be able to give 100% of our students a positive experience coming back to school.
And then it looks like the last question that we have here is somebody was wondering if when busing info is going to be sent out, because we not received bus assignments yet. When will busing info be sent? I know that was being worked on last week, I believe.
Yeah, so you should receive your letter. If you haven't already, it should be today. But you know what? That's a great question, because I'm not sure I received my letter yet. And I know it did go out. I know it went in the mail and it's there. So I'm hopeful for today. You can always write to sgfbus@sgfcsd.org to find that information out. But I do know some people have already received their letters because I've gotten calls on them. So it's always good to double check just to make sure that busing is there. I will tell you, speaking of busing, as far as transportation goes, the principals will be relaying to you about drop off and pick up. We do expect there to be more this year than in previous years. And so that the procedures for the elementary schools will be similar, if not the same as last year, and the same with the elementary and the middle school and the high school. But I will let the principals make sure that that information comes directly from them on what is going on there.
And that's it on my end.
Okay. So I do thank everyone for taking the time to meet with me. I think that when Mr. Dawkins and I spend lots of our day talking about reopening, first and foremost, we can't wait to see our students. We know that they want to be here and we want them to be here. And we want to do it in the safest way possible. I also know that as I get ready for a presentation, I know that there will be many of you that are disappointed with anything that we say on both extremes. And while I'm sorry for that, I also know that we have to look at what the best practices are to reopen. We are happy to take any other questions that you have. We will be doing another one at 6 o'clock tonight. We will be listening to anything. And obviously, if anything changes this week, we will be doing an emergency town hall to change any of that based on any recommendations. My last slide said communication will be essential to keep our students safe and in school. It is essential. And the majority of our people here really have been working with us and have been helping us because you've been sharing your experiences, your ideas, what your children are going through. And that is what is keeping us all together. Please continue to do that. Continue to talk to your school nurses, continue to ask the questions so that way we can have a safe opening. Tim?
Yes. Yeah, so there is another question that just came in again, and it was part of another question, and I apologize that we didn't answer it fully. It was a question about whether there will be a virtual option for students who are not comfortable being in the building.
So right now there is not a virtual option for not comfort. However, if you have extenuating circumstances for medical and you would like to talk with me about that, please just send me an email and I'm always happy to have the conversation individually because I do know each family has different circumstances going on in their world. Okay, with that said, I am going to stop the live streaming. Again, if some of your friends weren't able to do that, we'll be doing it again at 6 o'clock. I will be recording that one so that way there's information for all. Have a great day and we look forward to seeing everyone